Sadly, Minister, this legislation on quarantine is the latest instalment in the totally defective and failed policy of this government for dealing with COVID-19. In this case, to be honest, the legislation is nothing more than quarantine by name, but not in effect or not in practice for incoming travellers, and therefore will continue to allow the virus and the variants to move into the country freely and completely undermine all of the huge sacrifice and hardship that the public are going through. People have endured now 2 months of harsh lockdown, but because you refuse to introduce a mandatory quarantine on all non-essential travel into the country, and simultaneously you refuse to deal with those employers who are breaking the lockdown and ignoring the work from home provisions of public health, you are undermining the huge sacrifices and efforts that everybody else is making, and you're guaranteeing that the lockdown will go on indefinitely. You are prolonging the agony because of indecision and half measures, and this legislation is really one of the most extreme examples of half measures when it comes to dealing with the importation of the virus. I mean, the idea that we select out 20 countries, particularly from Africa and Latin America, and one from Europe for some odd reason, but the vast majority of other countries where we know, in Europe, in the United States and many other countries where the virus is circulating at very high levels, where the variants are present, and where we know that these variants can and will come from, there's a different set of rules that it won't require quarantine from those countries. It's absolute madness. It is full of holes and it renders the entire thing meaningless. But it is indeed linked to the government's half-baked policy when it comes to dealing with COVID. And I have to take this opportunity really to say, you know, the Taoiseach should start to be honest, because he was thoroughly dishonest today when he said to Deputy Murphy that those who advocate for zero COVID want a longer lockdown. Under your policies, we have been locked down for 9 months out of the last 12 months. And we will be locked down for months indefinitely because you continue to allow rogue employers to break the lockdown regulations, and you continue to allow incoming travel from countries where we know the virus will come and the variants will come, undermining the public health efforts, undermining the enormous sacrifices that our healthcare workers have endured to deal with this pandemic, and guaranteeing the continuation of the surge lockdown pattern. You've learned absolutely nothing, but you want to pretend that you are doing something, and it is really inexplicable why you are doing this, except from some misguided notion that you're doing so to protect certain economic interests by doing so. I can only imagine that is the reason why you're doing it, but of course that is so short-sighted, because in truth, failing to decisively drive down the virus, chase the virus and then prevent the virus coming into the country is actually a recipe for far more severe and long-term economic damage. And that is exactly what has happened. What we are arguing for is a clear policy of acknowledging you can't live beside COVID-19. That is a fantasy, a dangerous fantasy, a fatal fantasy for more than 1,000 people in this year alone, who have lost their lives as a result of that fantasy, that it is a half-life, not living, for the vast majority of people who remain indefinitely locked down, and the virus chases us. That's what you're allowing it to do. It will chase us coming in from countries abroad, It will chase us here in the community because you continue to imagine there are tolerable levels of infection. And really, people should think about it. The government are already talking about lifting restrictions when infection levels are still 3 times higher than when you lifted the restrictions before December. And you imagine you will be able to manage and control this, and simultaneously you have a quarantine regime that doesn't apply to the vast majority of countries where the virus and the variants are circulating. It is truly madness. So I would appeal to the government to wake up, because you are taking a serious gamble. And of course the irony is you are worsening the possibility of losing that gamble because of the half measures on travel quarantine. You see, if the virus continues to circulate, and if you continue to allow more variants in because you don't impose quarantine on most of the countries from where those variants come, the chances of the vaccine programme on which you are depending, which we are all depending, being actually undermined are far greater. The more variants that come in, the more the virus circulates, the greater the possibility that one of those variants will evade the vaccine, and then we will be in serious trouble. If, on the other hand, you drive down levels of community transmission to zero, if you have the public health infrastructure, the tracing and testing infrastructure to deal with outbreaks, and you prevent travel and the reseeding of the virus through travel coming into the country, then the likelihood of the vaccine programme working and being effective and actually eliminating COVID-19 and actually allowing us to get our lives back and end the misery of a long, protracted, semi-permanent cycle of surge and lockdown is far, far greater. A few specifics about the legislation. We have put in amendments, obviously, saying that all countries should be included and all non-essential travel should be subject to the mandatory quarantine. We have also put in amendments to deal with the outsourcing, which is facilitated by this legislation, which it is noticeable that in Australia, where they run an effective quarantine regime, they don't allow it. You're planning to outsource many elements of the services that will essentially provide the quarantine facilities to agencies and other business interests that want to make money out of it. Now, not only is that disgraceful in that facilitates potentially people profiteering out of the quarantine regime, but it also threatens to undermine the health purpose of quarantine, because if you have agency people moving from one quarantine location to another, you heighten the possibility that those agency workers will in fact spread the disease. Something specifically precluded in Australia, where people are directly employed by the state authorities and they stay at one location so they don't spread the virus from one location to another. We also do not understand why you've made a whole series of exceptions, and in particular, why on earth are politicians, diplomats and state officials exempted from the mandatory quarantine provisions? Is there some notion that politicians and diplomats don't carry the virus or can't carry the virus and the variants? It's ridiculous. Politicians and diplomats and state officials should be subject in the same way. Of course, we need to deal with issues like haulage, direct logistical work and so on, but why you're allowing for so many exceptions, I don't know. The very last point I want to make is sort of related, is, you know, in all of this, the government have praised, when it suited them, the healthcare workers who've borne the brunt of this on the front line of COVID. But like so many things, you praise them when you need them, or indeed when you want to exploit them, but then you abandon them when you think nobody is looking. And I just think it should be noted that yet again the student nurses, represented with a statement by the INMO in the last couple of days, has pointed out that the student nurses and midwives, to whom promises were made that they would be recognised and acknowledged for the work they continue to do on placements on the front line of COVID in our health service, have been abandoned. You've abandoned the student nurses and midwives. They're still not getting paid. Those that are getting paid anything are being paid less than they were last March. They're even being told they may have to repay the time lost on placements later in the summer. So they're they're actually going to be punished for working on the COVID front line. That is a disgraceful treatment of our student nurses and midwives.
Deputy Palmer.